what we witnessed this morning, most importantly, is the renewed memorandum of understanding, with IHH, and thank you very much, IHH Malaysia, to provide care and treatment for another 500 cancer patients from MOH hospitals in Malaysia through IHH hospital network, namely Pantai Hospital, Gleneagle Hospital, and Prince Court Medical Center. A program that is known as the Live Renewed Cancer Radiotherapy Corporate Responsibility Program. And as well, we also witnessed, the Gleneagle Hospital launch of the Emergent Scene. The MOU continues to support the National Strategic Plan for Cancer Control Program ending 2025 from 2021, to widen access to care and treatment for cancer patients in the country, building on continuing collaboration between MOH and IHH Malaysia. And you know very well that the World Cancer Day that celebrated 4th February last week, we had the theme of closing the gap. And closing the gap reminds us, seriously and critically of those that have been denied or those that not get access to treatment, let alone screening. And cancer presents the number 3 killer after IHD, respiratory, COPDs, emphysema and others, and then comes cancer as the cause of premature death in Malaysia. We want to see greater collaboration of public-private synergy and working together, and particularly to mitigate and alleviate an increasing and pressing challenge of cancer, of which we should undertake the war on cancer very soon, if it is going to be very challenging, as stated by some specialists, that it will double in 2040 or 45 by way of mobility, by way of cases.
Dr. Seri, you mentioned in your speech that there is no other option but to work with the private sector, especially the need to top up the GDP. So under your national health reform proposals, would you make it mandatory for other private hospitals besides IHH to extend care to the top 4 killer diseases, such as with the model of IHH?
Yeah, of course, a very important question. But I would believe that in the way of a Madani government and the way I would provide stewardship in MOH is to make the private sector and the private healthcare players to understand that the way forward is indeed to collaborate and partner with MOH. And I stress that the critical prerequisite perhaps is to enhance value-based delivery. And by that, I mean when we have the capability of doing a strategic purchase from a single purchaser of an MOH entity, whatever that may be, XYZ, PH Corp, and other possibilities. What is most important is for the private sector to understand that the way forward is to collaborate and to work with MOH, because as a minister and as MOH, we are not just, we are in fact the custodian of health for both public and the private sectors. And I wouldn't want to say that we would make it mandatory. Of course, that would not be possible. No required for the time being. But I think it's most important for the private sector players, APHM particularly, and others, big ones like IHH and as well KPJs, that they themselves, out of their own conviction and out of their own commitment to come on board with us as to enhance not just infectious disease, pandemic kind of thing. Those were the days that you will really help us a lot.